Send a picture, send a picture
Okay,
for
all
him.
right, all right.
Ya está.
Good, good.
¿Ya estamos en vivo? Ok, nos vamos
Yeah.
a tomar una foto primero.
All right.
That's nice.
He's typing.
So, hello everybody. Welcome back. Today we will have some transmissions because we have the visit of good friends from Microtech Technology.
Microtech endoscopy.
Endoscopy, Microtech Endoscopy. So they are bringing a lot of excellent products to the market, and the idea is to show you how to apply and when. So first and all, we want to show you. So I am here with my friend Mr. Lee, Chris Lee. Chris, come here.
Okay.
So here on the cameras. So
Hi,
so
everyone.
Chris, can you help us? We have a new cap that we will use today. Puedes prender la lámpara. So this cap is a different cap, and is designed by my good friend and genius.
Dr. Ken Binmoller.
That's it. So Kenneth, this is amazing, huh? So I am really impressive. Préstame para limpiar aquí. So the cap is a little bit different. So can you explain? This is the name of the visor cap. That's it.
Yeah. So the name visor cap is from Dr. Binmoller. So the idea is like the visor cap, the visor hat.
Okay. So I
So
will show you this here in the camera, probably.
yeah, it protrudes on one side. So the difference between this cap and the traditional cap is it has one side that's protruded, and you can use that side to dig under the lesion or push the lesion away. And it's a very simple but genius design that can help with some of these tunneling and ESD procedures.
So this is very interesting. So I will do a poem today. So Kenneth, thank you so much. The idea is
Let me
uh,
text him just that we started.
so you need to put the cap in this way, and it have a small area here. Prende la lámpara. No. So it's a small area, maybe in the scope. Prende el endoscopio. You see this area? Puedes poner la imagen de la endoscopía, por favor. Imagen endoscópica en grande. So you see this area? This area needs to be exactly in the point of the working channel is going out. So it's very smooth also. So
Yeah, it's a soft cap. So
it's
you
a
gotta
soft
line
cap.
up the notch with the working channel. So
Yes.
the idea also is it doesn't interfere with the instruments coming out. So not only you have the utility of pushing the lesion away, but it doesn't interfere with your instruments.
Very nice. So we have a patient today. ¿Cuántos años tiene la señorita? So a 30 years old woman with achalasia. So we have already performed the manus scan and what were the results? ¿Cuáles fueron los resultados? ¿Dónde está este chico? So we had 1.4 millimeters of distensibility in 20 at 20 with the balloon at 20, and then at 30, and when we were at 30 of distensibility was similar. So it's the same. So very tight cardia. So now we will measure here. So exactly. So the cap is very good, huh? I like it. So 44. So I need to cut from here to.
We're also working on the clarity, so make sure we're trying to improve the clarity of the cap.
Yeah.
So in future generations, you will see better clarity.
Yes, but it's not bad. It's good. I like it. I can see. Necesito bajar un poquito la paciente. ¿Qué es esto? Sí, pero la mano no está bien puesta.
I should have brought one of those masks.
Levántale un poquito la cabeza. Sácale la lado. Okay. No. So now I will use I will show a little bit some of the technology that Microtech endoscopy have, and that I believe is very interesting. It's a 44, so I will start my point here. Yes, yeah. Okay. So as I already explained, it's very important to clean the area and that the patient doesn't have any infection with candida. And one, no, normally not. So we will see what happened. So I will use now the pinpoint injection needle. Can you explain us what is this?
Sure. The pinpoint injection needle
Put here.
has a 3 millimeter needle extension. Compared to most of the needles on the market, the pinpoint needle will allow you to go directly into the submucosa.
Okay.
You don't really have to try to withdraw while you inject. So that's, I know, usually a maneuver that physician uses, but this one you don't have to gas. It goes right into the submucosa for all the injections.
That's perfect, Chris.
Please try it.
I am trying.
Okay.
So one of the disadvantage of the standard needles is that, as Chris already explained it to you, is that sometimes we pass a little bit more, and we don't go inside the submucosal area, and we need to go inside the submucosal area.
You know how?
So
I will use also your
yeah,
injection.
what we call a blue boost. It's a hyaluronic acid based submucosal lift agent.
Can I see that?
Yes.
Can I see the? So the name is Blue Boss.
Blue boost.
Boost.
Yes.
Okay, submucosal injection solution. So we will use this because the cushion, it takes more time. Does it?
Yep. Yes. So it is using a natural substance. So most of these submucosal lifting agent on the market, they use a synthetic polymer. So the hyaluronic acid is commonly used in the cosmetic industry. That's a natural substance in the body. So this one not only will lift the submucosal, but is also using a natural substance.
Yes. Excellent. So let's use it.
Yeah,
Okay, déjame
as
sacar.
I think most of the papers say the hyaluronic acid actually absorb 1,000 times of its weight, so
What I put on my
it
face
accumulates
Abre.
all the fluid.
Hyaluronic acid.
Inyecta.
Wrinkles.
Oh, perfect. So you don't need to move too much the needle. It goes inside directly.
Is that how you feel?
Perfect.
Good.
Very nice. I like it. I love it. Okay.
Great.
So now we have the acid hyaluronic boost.
Yes, and see how
Cushion.
long how long it lasts.
And now I will use
That's what he's doing.
the Herbajet to do my poem.
Okay.
Why? Because
Well,
this
that's what it's
patient had
indicated for.
already
You
many
use it
treatments
for
with balloon dilations, and probably I will
temporary
see a lot of
marking.
Fibrosis.
fibrosis,
Okay.
yes, at the end. So I believe it's better to use this
Sure,
because
sorry.
have more power.
Okay.
Actually, I need to. Can I? I wonder if I can peel this off. No. I need to get the barcode.
Ok, abre. No, abre todo. Ahí. No está conectado.
Oh, grounding pad. Mm.
On my forms. Thank God you're here.
Well, so the cushion is perfect, huh?
Sorry.
So now I am doing the incision.
The other
Very good.
one is the cheaper one, the Blue Beacon Indigo
And now-
Carmine for chromo, but you can mix it with
Very nice color also, huh?
saline
Very good,
for
very.
lift too. It's the cheaper option.
So it's very important when you do the incision is to dissect the submucosal area. As you see here, the hyaluronic acid from Microtech is good because you see even if I cut in, it doesn't goes out. That's good, very good.
It's good to hear.
Very ideal for ESD, I believe. Huh?
You may
What other submucosal lifting agent do you use today?
Finn Muller did.
Normal saline
Yeah,
solution.
yeah.
Okay.
Oh,
Because
yeah, no, it
until
wasn't
now
his.
inside
Yeah.
the Ecuadorian market we didn't have any product registered. I believe that Orize is also registered now
Okay.
from Boston Scientific, but this product is very good. This I believe
Yeah.
is even much better, huh?
Yeah, I have heard something about Orice interfering with some pathology. Have you heard of that?
Yeah, I heard some of these things, but it needs to be proved. You know,
Okay.
it's difficult sometimes to prove, but I believe both are very good products.
Okay.
But this is a very good product. Huh? Look, I am cutting. I am dissecting, doing my dissection. So it's very important to have a very good dissection. You see here now, I am very well open, and there is a still, the cushion is still there. So it's fantastic. That is good, very good.
Do you have the traction device? Okay, maybe next.
Yeah, but
Yeah,
he's doing for poem though.
yeah. Dr. Robles, whenever you feel that you need some traction, we also have a traction device for you to try.
Do you have what?
A traction device. So it's
Traction
a-
device?
Yeah, it's basically a rubber band preloaded on a clip
We don't use
that can
traction
provide
poem.
dynamic traction for
Oh,
you.
that's good. That I believe is much better for ESD.
Yes,
Yeah.
yes, it is.
In poem, I believe I don't know if we can have a views because we open in a different way and we go inside in a different way.
Yeah, we'll show it to you, and then if you run into a ESD case, we can
Yeah,
try that.
I will say Sierra. So now I use the water channel of my endoscope to go inside faster and not the air. You see?
Mm.
And I believe that the cap is very good because you go inside faster.
You like the cap?
I love it. It's a
That's
good
great.
invention of my good friend and a genius. So it's perfect. I believe it's perfect. Look, I am inside now, and this is one of the biggest steps now. I
How do
see-
you feel with the rigidity of the cap? We're
It's-
still trying to
I-
make some adjustments, but
I think it's good.
okay,
I think it's good. It's perfect.
great.
And the clarity, you see, probably improve a little bit more that, but it's very good.
Okay.
Haven't seen a
So now I'm starting my dissection of the poem now. You see, the hyaluronic acid of, what is the name of your product?
The Blue Boost
Blue
or-
Boost.
yeah.
Very good. I like it.
is still holding the lift.
It's still holding the left.
Okay,
Yes,
that's
that's
great.
good.
What setting are you using for the dissection?
Now I am using a spray coagulation. I love it.
Ah, okay.
So because you don't need to change too much, to do a coagulation. You see, the vessels are coagulated immediately, and that is very good.
Do you ever use coag graspers?
I
in
use
this-
it, yes, sometimes,
Okay.
but for point I use less and less because of the technology that we have, that is spray coagulation. So is I can go faster. I don't
I
need to
see.
use too much to change.
So you're basically dissecting and also coagulating, spray
Yes.
coagulating at the same time.
Yes, spray coagulation was designed initially for liver surgery. So they
I
cut
don't
in.
see this techniques used very often. I mean,
No.
is this
No,
you using this?
I use it because
Yeah, that
I
that-
like it. You see,
yeah.
there is a vessel there.
Do you feel this reduce the chance of bleeding?
First, reduce the chance of bleeding, and second, reduce the chance of use other materials. So the exchange takes more time. So you see, I am pushing with your cap, and it's good because it's not too rigid, and it's soft, and this is good. So with the
Yeah.
other caps, what I have is sometimes when I am pushing, I do some indirect bleedings.
The other advantage of this visor cap is fluid doesn't accumulate because you have one side that's really close to the tip of the scope. You can suction all the fluid out. So while you're pushing the lesion away, and you won't really have any fluid accumulation.
Very good, very good. I love it. I need to order now. I need to purchase. Kenneth, you will be rich now.
Yeah, I hope Ken is
Again,
hearing or,
oh
or
my
watching
God.
this. I'm gonna text
Oh.
him.
Wow, incredible.
of our products in Advent help, right? You know?
I think the capability of the cap is very good. It's smooth.
Why do you feel a soft cap is easier than a rigid cap?
Yeah, I believe. I believe it changed a little bit. Even when you are pushing, you have a good force to push the submucosal space because we are working in a third space, you know. And I had the idea that probably at the beginning will be not so good, but look, I am pushing, and I don't have any problems. You see,
Okay.
I am pushing, and I am doing my dissection.
And it
So,
doesn't interfere. with
Doesn't
y-
interfere, and I believe it's doing the same that with a rigid cap. So very good. Diga.
Kenneth Müller está preguntando si la solución se puede inyectar a través del Hybrid Knife.
I don't believe. No. No. So Kenneth is Kenneth. Hi. We are talking very good from from you. You're a genius always.
Oh, he said he's watching live. This is great.
Yeah. So we cannot inject through the RB for the moment, the solution, but so I use a standard saline solution. But I believe will be great if we can do it in the future. So I know that Microtech have something coming to the market now. That's it.
The knife, yes.
The knife.
Yes.
So
Yeah.
we can probably inject the same solution.
Yep.
And this will be great. The cap is working fantastic, Kenneth.
Yeah, he's watching live. He just texted.
I really love it. And I believe it will change the rules for people doing ESD and Poem. Because this cap is amazing, huh?
He's actually transmitting from his center right now.
Oh, that's good. So hello everybody in San Francisco. That's good. So you see, you know, when you are doing the dissection, I believe that the design of the cap is also helping you because we push and we dissect also with the cap.
Okay.
So I think it's very, very, very interesting. This is a totally different, new concept. So I can dissect just with the cap. Look,
Wow.
doing the force. You see, I am just finishing my tunnel. I have 70 minutes, and we were talking a lot.
So this is faster than what you.
I believe that could change also some kind of. We need to be measured in a study or something like that. But I believe my first impression is that the cap is very good. The transparency is good. It's very. I think it's acceptable. Very good.
Okay. Yeah,
I
we're
can
still
see-
making more improvements on that
Yeah.
one. Yeah.
And when you arrive to do that, will be perfect. Will be perfect. Even if it's not a rigid cap, we have force to do a dissection with the same cap, and the difference from other caps is that the rigid caps, when you push, you may bleed
Ah.
the vessels, but here no, you are doing a real smooth and like doing a dissection like surgeons with
It's
the
like a
with
soft
the-
dissection, right? Yeah.
¿Cómo dices dedo con el with the fingers? Surgeons when they do they don't want to be traumatic, and to do a dissection they use
Okay.
the fingers,
Ah.
and it's less traumatic because it's not hard.
I see.
So I believe
So this is almost like a finger.
almost like a finger, yes. That's right. So I think it's a very nice concept. I believe that I'm going faster with this. It's because of the cap. You see, I can push. Perfect.
Mm.
No bleeding. Do you see any bleeding?
Mm.
Do you see any bleeding?
No.
Lee.
No.
Huh? No. bleeding.
Everyone.
No. Or I am just.
It's a nice looking tunnel too.
It
Look,
is.
Look,
It's beautiful
I am
tunnel.
passing with the cab and doing my dissection. I'm the cardia now. You see? I am at the level of the cardia now. So
Wow, this is really
fantastic. This
exciting.
is great. Very great product. Congratulations. Kenneth, it's perfect. As always. Kenneth, if you have a question about your product, I can respond now. I can answer now. Huh?
Well, we're texting live, so he can. If you have anything you want to say, I can transmit.
Yeah, it's perfect, my friend. It's perfect. Your cap is perfect. I love it. Look, I am doing a dissection. I had a lot of problems also in this area with the normal caps.
Mm-hmm.
That is, when I push to pass going through the stomach, the rigid cap do perforations also.
Oh, okay.
But probably with this cap, not.
Yeah, because
I need
it's,
to
it's
test.
soft. Yeah,
I need
test
to
it.
test.
Test it.
It need to pass all the proof. Kenneth. So I am pushing now. So I am doing the dissection with the cap.
Oh wow.
So now is now I need to cut.
So what do you normally do with those blood vessels? Do you try to avoid them, or do you try to coagulate them first before
The,
you?
the vessels.
Uh-huh.
So normally it will depend. I prefer to do a coagulation.
Okay.
I had one vessel behind that I less because was in the mucosa area, so I try to avoid to, to do a coagulation of this area.
Okay.
But with the cab, normally with the standard cab, I will have a bleeding immediately because of the cab.
Right.
But with this cab, is different. Have the perfect
Stiffness.
stiffness. Yes, perfect stiffness. I was with some doubts at the
Skeptical.
beginning when I try in my finger.
Yeah, it is soft. Yeah.
But it's good. It's very good. So you see, so we have some fibrosis here in this area.
Can you do spray coag with other knives?
Yes,
Okay.
I will use with your knife.
Okay.
I will try your knife. So now, 下了。 So look, the cap helped me to go through this area smooth. No bleeding of the vessels. We have a lot of vessels here. This is a fibrotic area, as I suppose, because this patient had a lot of dilations before. So it's perfect. Really perfect design. Perfect idea. I love it.
I think with all of Ken's inventions, he really thinks, how these situations happen and how to deal with these type of this type of lesion.
Yes.
a lot of fibrosis you're cutting through.
Yeah, there is a lot of fibrosis in this area,
Yeah.
but I am arriving now.
So Ken's comment, beautiful demonstration. The cap is protecting the left side where the mucosa is. Especially when using spray coag, there is a higher risk of transmission of current. So protecting the mucosa is very important.
Yes.
Unfortunately, Ken said he used underwater. Unfortunately, the spray coag doesn't work underwater.
Yeah, I know that. So this is a lot of fibrosis. I do a hole in my mucosa in the cardia now, not because of the cat, because of my knife.
Mm.
You see there? But it's okay. I will use your product. I have now a close device. What is the name of this device? The new clip.
What? Which
The-
device?
I'm
That
sorry.
one that open in both sides.
Oh, the DAT
Oh.
clip, DAT clip,
DAT
the
clip.
dual action tissue
Duo,
clip.
yeah, that's very nice.
Yeah.
We will try now. This was a perfect case for how we can use all your technology.
Yep.
Perfect case.
Ah.
Ciérralo un poquito, está muy abierto. Let's see in the fibrotic area, very fibrosis, you see? Very big fibrosis. But it's okay. Important bleeding out. So you have a core grasper here?
Did we bring a coag grasper? Oh, no, we didn't.
No?
No, yeah.
Okay, I will use
We
my core
didn't,
grasper
okay.
now. So we have a bleeding, but there's a lot of fibrosis in
What?
this area
We got anything that's
at the cardiac level.
No, the coag grasper is.
the hot clip, you mean? Oh, I didn't know that we were coming out with that soon. Yeah.
Abre.
The hot clip
Cierra.
would have been good too, though.
Yeah, yeah, exactly.
So doesn't interfere the cap with the with the material, and that's good, very good. A ver, un segundo. Ok, abre que estamos ahí a los lados falta. Abre. Ok, cierra. Ok, abre. Perfect. Cierra. It's perfect. Now we'll advance. Sí. Sácalo, sácalo. So even with fibrosis, I can push with your cap. You see,
Mm.
I have a hole in my mucosa up in the upper part, but it's okay. I am dissecting. I am continue dissecting. Abre, abre. No abras tanto. Ahí nada más.
There's one physician in China that commented um, that potential use for this cap is for upper GI bleeding, where you could use to tamponade, and then use a lot of water to flush it off, and then find the bleeding site.
Yes.
Because, do you agree with it?
Yeah,
You
I
think
agree.
that might be
Yeah.
useful? Okay.
I agree. One of the advantage of the cap is that the water doesn't stay there.
Yeah,
And
exactly.
you don't need to do a big aspiration or a lot of aspiration. So I think
Right.
it's great. The design is great. I don't have any comments regarding the design. Any
Such a-
issue?
It's just such a simple design, right? Simple idea,
Very good. The simple ideas always are the best.
right?
It's like the songs. The songs that have a lot of things regarding musical notes are confused, but the simple songs are most beautiful.
Yeah, you can sing along very easily.
Yes. So now I am working with my cap to go inside this area because this area is a lot of fibrosis. You see,
Yeah,
the
it's a
cap
lot
is
of the fibrosis.
adaptability is very good.
Okay.
So I like it. I like your cap. Really like it. I believe it's nice, very nice. This is fibrosis. That's why we are taking a little bit more of time. But I believe in a standard ESC or without fibrosis or poem, probably we can go faster. Okay.
Yeah, some additional comments from Ken. Love the beautiful demonstration of how the leading edge of the dissects. And the cap keeps the mucosa opposite the knife always a safe distance away, essentially creating triangulation effect. That's what he said.
Yes. Totally agree, Kenneth. So now I am using the water, you see, to open a little bit more. And look the adaptability of the cap is perfect. Now I am in the stomach. Now I am in the stomach. You see the fibrosis here.
Mm.
Okay, it's but it's not a big deal, and the cap working very well. It's the adaptability of the cap because of the flexibility, the
Okay.
stiffness of the cap. It gives you go inside faster, and not doing more damage of the mucosa that I do, and it's good, very good. Congratulations.
Congratulations to Ken.
Ah, congratulations to both. You support his idea, and that's great. Bringing to the market this kind of new caps you know, that is something that probably is simple, but very helpful. I believe it will change a lot the rules also. So in next days in July, I would like to announce we will do a journey of poem.
Mm.
So Michel Cajal is coming, my good friend. Dr. Batista is coming also from Venezuela. So the idea is to have a full day of poem. So we will discuss with Lee now regarding the caps and all these clips
Sounds
and
good. Yes.
to be to see if we can use it during of live transmission there.
'Kay.
So it will be for free in YouTube channel. So just saying us what day should be better, Friday or Saturday. I believe that Saturday is better because less people is working. So you can ask directly to all these masters in poem
I want to. If they're gonna be
what
using
they think about new kind of specific clips and technology that we can use in poem.
I gotta learn Spanish.
Yeah, that's
So
great.
don't forget that
Yep.
here in this channel.
Mm.
So it's very important to see the cap, the tip of the cap, the part of the, the highest part of the cap, how the adaptability is going, and this is very nice. This is good. This is very good. I really love it. So, you see, I put and I push with my cap now. So I am almost there, just finishing my tunnel.
Yeah, I know the fibrosis always is a challenge.
Yeah,
Right?
it's a challenge. Yes, this is important. That's why to use water and
Yeah.
good injection with power, good power because you can go faster. Because if not, I will take a lot of time.
Mm-hmm.
But now I am okay.
All weekend. All weekend.
That's why it's very important to know with which material you will use, what material you will use during your poem.
Right.
If this is a patient that has been manipulated many times with dilations and everything, the risk of to have this fibrosis at the end is very high.
Yep.
So it's a difficult case, but with correct materials, I believe that you arrive to do the good job. So I will finish 1 centimeter more, 1 millimeter more, just to be sure, because I don't want to do a redo poem in this patient, okay? So it's better to have a good dissection, more space. So again, look, I am using my cap
Mm-hmm.
to see the adaptability of the cap to the region, and no problem.
Feels like you can almost squeeze it anywhere,
Yes,
right?
yes. That's, that's perfect.
No. I'm off. Why? Why? Hmm?
Let's see now. Quiero el aquagrasper.
Mm.
So I have a bleeding now. I will use the aquagrasper. I finish, huh? Okay, ahora.
Ken is actually commenting on the transmission channel
Channel.
right now. So she's putting a lot of comments down
Oh, yeah,
below.
Sierra.
Yeah.
That's good. Very good product, my friend. I congratulate always, huh?
As I said, standard cap hinders maneuverability
yeah.
of the knife, but now we have no obstruction where a knife comes out of the
Sierra.
working channel.
Yeah. No está funcionando. Ah, está funcionando, ¿sí? Okay, abre. Segundo. Okay, perfect. Now, we will do our dissection now. Dame para comenzar acá. So you have your IT knife, something like that? What's your
Yeah,
name?
we have our gold knife. Go ahead. Yeah.
So
Yeah, that's the one.
what is the advantage of this?
So for this ESC knife, we have similar cutting diameter as the dual knife. So it is a so it is a
Ponlo ahí.
give you a very nice clean cut, but you can also inject through the middle channel of the knife.
And it's isolated, the tip.
This one is not the IT knife. Is this the IT knife? So the
No,
insulated
just to
tip.
know. Isolated?
Just the T.
Let me see this. Did you just
Just-
bring this one?
No, I brought the 235. But
Okay.
that's the
Let me see that.
only-
So I
Yeah.
can inject, but this is not isolated. That's it. Okay. Yes,
uh,
it's not isolated.
It's not. Yeah, this
Yeah,
is
it's
not.
good. Perfect. It's
Okay.
perfect. I
Okay.
will use that.
Okay. So use this one. Okay.
Or it's like
We actually call this gold knife because the tip is coated in gold to reduce charring, to reduce tissue charring on the tip.
Gracias.
Okay.
Is that a clip?
So
or-
abre.
No, is he ready for it?
No, not yet.
It's over here.
Which one
I
is
have
this?
Sí, sí.
Oh, okay. Yeah, that's fine.
She has it.
So I am starting my myotomy now.
That one.
Perfect. So I always do complete resection of the complete myotomy. A lot of discussion regarding that. I don't have any problems with that
Okay.
with my patients. So in my experience, it's okay. It's cutting perfect. This is cutting, you know, as you told us, the current is focused just on the tip.
Yep.
And not, you know, going a little bit outside. It's perfect. Very nice. I am using a spray, you see, coagulation, you see?
Oh,
look,
you can still use it. Nice.
beautiful.
Okay. So it worked with all the instruments.
Yes. This is perfect.
So do you use dual knife more than hybrid knife, or do you use both knives?
No, I normally use one knife. It's okay.
Okay.
So if I can inject with pump in this instrument, I will
Yeah.
use this one. Yeah. I like it. Perfect combination. Your knife and the visor, cap visor, that's it?
Yeah, the visor cap.
The visor cap. Very good. V cap. Really nice. I love it. So you see there are some vessels, but the cutting is perfect.
'Kay.
What is the difference? Why is so you know, so concentrating the tip?
Yeah, because
The
it does
energy.
have a higher electrical current than the current density than the hybrid knife, because it is a smaller a thinner knife, so you will have kind of a sharper cutting effect.
Yeah, very good. I really like it. Really like it. So normally I like to do some spray coagulation when I am doing the dissection, because if there is a vessel between the muscles when I am cutting,
Mm.
so I will not have the bleeding, you know. So you see the visor cap as the adaptability of the visor cap
Right.
is very good. Very good.
I need to know what settings he's using.
Yeah, I think the Ken's idea is you provide that protection. You dig into under the tunnel, but don't interfere with any of your instrument movement.
I really like it. So we have the mucosal defect that I do with my knife. I will close with the dual.
The dual action tissue clip.
Oh my
We
god.
call it DAT clip. DAT, DAT clip.
That clip. Okay. Very nice clip. You will see that, huh?
Yeah.
¿Le puedes decir a Bolaños que puede traer la cámara para mostrar cómo funciona el clip? Necesito la cámara o la GoPro o la otra.
Yeah, I missed one of Ken's earlier comments when you were using the coag graspers. He also said with this cap, it doesn't hinder any movement of the coag graspers.
Yes, it's true.
Are we what?
Cuando usemos el clip.
What? The knife? Not yet. That came from China. I don't think so yet, unless it's in the process. He has to get it from China. I know. That's why he's like, did you bring the coag graspers? I'm like, it's not launched. You mean? Like, but it's coming soon. Like, but I was in charge of the commercialized product.
Perfect.
Oh.
Yeah, the idea behind this knife is you don't lose any of the cutting ability with the thinner knife edge, but also give you the injection capability. Unfortunately, we don't have the pump hooked up today, so eventually when we have that, it will
For
give you both
my
injection.
poem course is for free.
We'll
we'll-
try,
You will
we'll
try?
try.
So I finished my tunnel now. So it passed the proof. Very nice, very good product.
Great, thank you.
Necesito cerrar el clip acá arriba primero. Con el dual, el DAT
The DAT clip.
clip. I need the DAT
I think
clip. So
Lindsay, you have to.
explain us a little bit
You
about
have to fire
this
it.
DAT clip. What is the
Okay.
advantage of this? So I have Lindsay here and
Yeah.
Mr. Lee.
How do I turn this on?
So I am going out from my tunnel now, and I will go exactly in this part of the damage that we have.
So the DAT clip has a middle post and two independently moving side arms.
So the design was do it for what?
So the purpose of that two independent side arms is you could grab one side of the lesion to pull it to the other side and close. So usually we're always looking at how
My
much the
arm?
clip will
Yeah.
open. A traditional two-prong clip will open, the bigger the opening, the better. But for the dual action tissue clip, you could close larger lesions without really worrying about
Yes,
the clip opening because it's independently moving. You could grab one side and come to the other
Measure it.
side and close it
Yeah.
together.
So we have a hole here, and the idea now is with the standard clip we will have some problems because we need to go one inside to other side. And this is a very amazing design. I would like to show you the design of the clip because it's developed to close this kind of defects. That's it.
Let's take this.
Wait, does this go
So
down
we
a
have
2/8?
Lindsay here. So
Go down
Lindsay,
to a channel? Okay, all right.
I think so.
Okay.
Right?
so can we show to the camera now?
Yeah.
That-
Go ahead.
I would like to show this this
The handle.
design. So you have two areas for open the clip, and can you show us, Lindsay, how it open?
Yeah, that yellow handle opens the gold-coated one side, and then the blue handle opens the other side.
Okay, we will see that in action. We can close. I can pass inside my channel now. Very good, huh?
I'm wondering, yeah, this is 2/8.
So the yellow is for the goal, and it's good. That's very
Okay.
nice. So podemos mostrar la imagen endoscópica now.
Right.
It's a little tight. Yeah.
Both at the same time.
So
Yep.
the working channel for this clip is a special working channel or the standard one we can use?
I thought, let me see. Oh, yeah, it doesn't really say. I thought this go down to a 2/8,
It does.
but it does?
I believe
Okay.
so, yes.
2.8
Sure.
millimeters?
Correct.
Oh, I'm sorry. Yeah, it is a 3/2, but it
Oh, wow.
jams. It went through a 2/8.
Okay, and the rotability is very good also.
Yeah.
So can you open the yellow one, please? So I am still using the cap. Can you open
you
the
open?
yellow one?
Yeah, he is.
Ahí abre.
There you go.
So, ciérralo un poquito. Okay, ahí está bien, perfecto. So,
Yeah, just open to grab one side. If you, yeah, so grab one side of the lesion. Yeah.
Mm-hmm. Mm-hmm. Mm-hmm.
Yeah. Close. Yeah, don't fire it. Yeah, just close.
Just close.
Yeah, just close. Make sure you grab on it. Don't fire it. Yes.
Yeah.
Right. Yeah, you open on the other side.
Rotate it.
Open the other side.
Yeah, he's trying. It's narrow. Spot.
Yeah.
It's too narrow. Really narrow.
So both are open now. Not too much. I believe it should be better.
Yeah, we usually need this to close larger lesions where you need to pull one side to go to the other. But you know, we may not need this to close this lesion.
Yeah.
Yeah, I think. Is this a 2A channel scope?
No, this is a 3.2.
Oh, 3.2. That should work. So. Can you push open? It doesn't open.
You can see, you can open just a little bit. That's good.
It doesn't open more.
Abre todo.
Okay.
Los dos.
Okay.
So now I opening both because I have a large defect here. So I'm doing an aspiration now. Okay. Necesito rotarlo así. And now I will rotate in the other area.
Nice.
So now I have both. Intenta cerrar un poquito ambos. Despacio. No, abre. Abre. So I don't have enough tissue. Están abiertos ambos, ¿verdad? Ok, quiero que cierres el lado dorado. Sí, cierra. ¿Y el lado plateado está abierto o no? Está abierto, ¿verdad? Lo tienes abierto. Pero no lo veo. Abre. Abre los dos. Sí. No, déjalo ahí, déjalo ahí. El plateado está acá. So. Okay. So I'm doing a rotation with the clip. The rotation is good. You see, I am turning, but I have clip in the left, the gold side,
Mhm.
Yeah.
and now I have my other part that is release. Okay, I have my clip very in a very good position now. The other part of the clip. So I need that you close. Cierra la otra parte. Okay, now. Okay, libera.
Both sides. Yeah.
Perfect.
Perfecto.
Okay. Dame un clip grande.
Give
¿Tiene un
me,
clip grande?
22.
Yes. So
Yeah,
now we will
let's-
use a standard clip.
Yep.
So you see peritoneum down. So it's okay.
This is easier. This one's easier.
And the shortness of the length of the distal part of the clip is short. That's it.
Yep.
That's correct.
Correct. Yep.
That's good.
Short stem.
Okay. So now this is a large clip.
Correct. 22.
This is a 22 clip. Okay, ábrelo. ¿Está abierto? So you see, very large clip. It's good. It's good for these kind of cases. Very good. Espérate, un segundo, necesito que se me vaya arriba esto. Cierra un poquito. And we aspirate. Okay, now. So I will use the cap to put my clip very well. The first one that I put it. So now. Okay, abre. So I like the rotation of the clip, huh? It's very easier. ¿Puedes rotarlo, por favor?
Have the gray here. And take this off here. Just here. Perfecto.
Okay, está bien. No. Sí. Okay. Okay, it's okay. Okay, momento. It's okay. Cierra un poquito. Cierra un poquito. Okay. Te digo cuando abras, ¿ya? A ver, necesito que... Ahora sí necesito que... Ábrelo todo. Ábrelo. Okay. It's totally opening now. Ahora sí. Ok, cierra despacio. Cierra, cierra, cierra. Vamos, cierra. Perfecto, cierra. Todo, libera,
Mhm.
libera. Okay,
Perfecto.
very good. Otro. No, no tan largo ahora. ¿Cómo? Sí, 16 está bien. So now I will use a 16 because it's less opened. I use it both clip, one big clip, large clip to close one and the other side, and then 22 millimeter clips, and then you will reduce the size of your clip because the hole is not so big. So that is the advantage of different diameters. Yeah, they have different opening. Yeah, that's good. Okay, gíralo un poquito. Ahora sí, abre. Okay, momento. So
Is
what
this
is
our-
the?
Is this our
Or
Lakato?
16, yeah.
Okay.
Correct.
So our Lakato
Abre,
clip
abre
actually
todo.
have on the distal end have some side teeth, so that will help you to engage with the tissue better.
Like,
Ahí, cierra espacio. Falso cierre. Déjame ver. No creo. Abre. Okay. Okay. Abre todo. No. Abre menos. So you can control the opening, ¿no? That's good. Okay, ahora sí, abre todo. ¿Está abajo o qué? Sí, ¿no? Okay, abre todo. No, it's okay. ¿Cuánto? Okay, cierra despacio. Okay, sí, cierra, libera. Very good, you see?
Okay.
Sí, another 16 I believe.
Yeah, the teeth also help you to recruit the tissue.
So explain a little bit more regarding
show him the tip.
the
here.
teeth that have
yeah.
the
So with traditional
Let me
clips,
show
you
him.
only have the front end engagement of the tissue. But with all these side teeth, you actually can have multiple points of tissue engagement.
Déjame hacerlo ahí.
So what you can do is to be able to recruit more tissue in between the clips, and then it can hold the tissue more securely in between the clip arms.
Okay, let's go to see in action. We have another case. I need to work.
Gracias.
Abre. No. Cierra. Cierra, hijo. Tienes que rotarlo. Rótalo primero, ¿sí? Me lo presentas bien. Abre. No. Ok, abre. No, no te muevas. No, yo no lo estoy rotando. Tú solo lo puedes rotar. Ahí, nada más. Ok. Ábrelo. No. Tienes que rotarlo más, hijo. Lo necesito así. ¿Sí entiendes? Ok. Abre. Abre. Perfecto. Ok. Cierra. Cierra. Cierra, cierra todo. Perfect. Very good clip, huh? Otro más. So I'm just finishing to close the distal part. The damage of the tissue that I had. ¿Este de cuánto es? ¿De 16? Do you have less?
We have a 11 as well.
11? Give me one
Yeah.
11.
Okay. Did we bring any 11?
Yes.
Yeah. Okay, good.
¿Para qué?
Yes.
Para arriba, sí. Very good clip, huh? Congratulations.
So our clips are also indicated to go through a side viewing scope as well.
Okay, perfect. Abre. Gira. 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 Necesito así, Clever. Ok. Nada más. Ok. No te muevas, no hagas nada. Esto- ¿Cómo? Ya me acomodo. Ok, cierra despacio. A ver. Sí, está bien. Cierra.
Uno
One more
más.
clip.
11.
Yeah, one of this one. Yeah, good. Very good, huh?
Uno.
Good. It's beautiful closure.
Yes.
So that's, I believe, the land of the, the open, the angulation and the land of
Yeah.
the clips is important. So you start with big clips, and when you are, in this kind of part, you can use less land, less angulation, opening.
'Kay.
So very good. So and this is very important because normally we use the standard clip, the same clip for everything. But the indication is the clinical indication in clinical practice, at least in endoscopy. Primero, muéstramelo bien. No está bien, todavía le falta un poquito. Ahí, abre. And then you will use the, the smaller one to close very well. Cierra. Cierra, sí, libera. So we finish. No,
Beautiful.
we need one. I put not well. You see? Not well.
Oh.
I will put inside. I'm going inside to see. Dame el clip. Uno pequeño. So here's my clip, you see. Here's the defect, huh? It's close, huh?
Are these all the fibrosis the
Yeah, fibrosis.
from the
yes.
dilation? Okay.
So I think it's here. Okay, dame el clip. So I will put the clip inside.
Okay.
No problem. This was experience from Dr. Demora in Brazil. So sometimes he put the clips inside. It's the same as we do a cholecystectomy. We put the clips
Okay.
inside. Rota, abre, abre, and I will close better. You see? Cierra despacio. Cierra. Cierra todo. Y verá, perfecto. Perfect. We left the clip there. No problem.
That's great.
It's closed now. You see? Perfect. Okay, now I will close my incision. Necesito clip. Dame el que tengas, no sé. El que tenemos abierto está bien. Good. Very nice. Nice demonstration. How to use the clips. How to use different diameters, lengths, and
good.
everything. Ok, rota. Rota primero. Ok, abre. Ok, rota. Ahí está bien. Okay.
Ken has been watching all along, but he said
Cierra.
you have to break off now. Beautiful demonstration. Take homes are
Thank
one.
you, my friend.
Yeah,
I really congratulate because the cap is perfect.
yeah. He has a few take homes. One, softer material works very well,
I
less
have-
traumatic to
I have
tissue.
more.
Will also
too,
be
if-
an
if you need
advantage
it.
when traversing across the cricopharyngeus. Leading edge facilitates dissection. Cap protects the wall mucosa opposite from the knife. Water does not pool inside the cap. So,
Thank you.
yeah.
Now, for us, was a great opportunity to see the soft cap. This, I think, is amazing. Very nice, Kai. Very nice. The adaptability of the cap inside, I think, is the most remarkable. And even if the stiffness is not the big, tienes que rotarlo, okay? It's not, like a hard, abre. So even if the stiffness is not so hard, it works very well because what I can remark from the cap is the adaptability to the
You have
tissue,
more.
and also works like the finger of the surgeon. Okay, un poquito menos.
Yeah.
Like the finger of the surgeon.
That's a very good analogy. Just
Abre,
like
abre
you
bien,
use your fingers to push it away.
Yeah. No estoy bien. Tienes que rotarlo. Ok, rota. No, para acá. Ok, cierra. Cierra, cierra, cierra. Ok, perfecto. It's good. There. Another one? Please?
Do you usually use different sizes of clip?
No, it's my
close?
first time.
Okay.
But I am looking regarding the clinical aspect and the endoscopy aspect, and that's the the benefit that I see to have different lengths,
Sizes,
and
yeah.
because you can go and you can operate easier when it's close.
Right.
So if you have a big one, sometimes it's difficult.
Yeah.
So
yeah.
you need to put the distal part of the scope more,
Right, right. Especially in a
distal.
tight space, right?
Yes,
The smaller
in
one
tight
actually
space.
sometimes
Very
works
good.
better. When it
Perfect.
got smaller.
So the idea is to use bigger ones, and then when the hole is closed,
Yeah.
the small
Good point.
one. So perfect. Perfect idea, perfect indication. I believe we had a good chance with this case today. And we see all the capabilities of the cab.
Yeah.
Extreme situation, even with fibrosis, so it works.
It's a big challenge for the cab, and
Big challenge for a
great
cab, yes.
great that it worked.
And it's similar when you are tested a car. So you go to extreme situations
Yeah,
with the
you take it to the racetrack on the first run, right?
just to see if the first impression is comfortability and all the things, but
Right.
abre. Abre. Okay. Okay, cierra. 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 Uno más. So one more clip and we finish. So we use your hyaluronic acid. This
Yeah. The lifting agent, the blue boost.
Blue Boost.
Yeah.
We use your needle. That was perfect.
Yeah.
3 millimeters needle.
The cap, the clip, the knife. You
The
used
knife.
everything.
Everything.
We use everything
In one
in
case.
one single case. So it means that's why
We're
have-
done. We're done now. We can go.
Yeah, you can go now. It's okay.
Oh,
That's
no.
beautiful.
Abre.
We still have the polyp traps.
Abre.
We
Yeah,
have,
okay. Yeah.
and a couple cold
Gira.
snares
Okay.
too.
Gira. Eso.
It's great. A fantastic case.
Cierra. So we finish. Cierra. Thank you for assisting us. Probably we will do a live transmission of US and cholangioscopy. So stay with us and enjoy it. Thank you.